Recently, the Louisiana Heart Center implanted its first AngelMed Guardian cardiac monitor and alert system. Joining us this morning to talk much more about what this is and how it works is a doctor who has since performed several of these implants, and its principal investigator. We have Dr. Bruce Eitel in with us this morning. Good morning. Thanks so much for coming in.
Good morning.
So this is a very interesting medical advancement, and we were just talking, there's been 6 of these implanted where?
At Lakeview Regional Medical Center.
Okay, and so how does this work and what exactly is it?
In the United States today, there's approximately 1.2 million people who develop myocardial infarctions or classically heart attacks. Out of these 1.2 million people, probably 40% do not survive, which is about 500,000 people. Out of those people, half of them die within the first hour of the event. The remainder of the people, probably 42%, die before getting to the hospital, and 8% die after hospitalization.
Wow.
So the method behind the madness with this device is to detect a myocardial infarction or a heart attack as soon as possible, so the person who's experienced it can get to the hospital for treatment. And as you well know, treatment for us is bringing the patient to the cath lab and opening up the artery as soon as possible. The quicker, the better.
Because time really is important in these situations, and we actually have some video we're going to take a look at of this device, and we can actually hear it in this if we want to go ahead and roll that. What is it doing right now? Is this the alert signal for when there's a problem?
Yes, ma'am. And basically what you have is the internal device, which is a pacemaker-like device which monitors every heartbeat. And you have a lead which is placed in the right side of the heart, which is the same as a pacing lead. And what it does, it monitors every beat, and the box that we implant has a computer in it, and it determines what's going on with the ST segments, which determine whether there's injury or not enough blood getting to the heart. This event occurs much sooner than we experience the symptomatology. So basically, before a person develops chest pain, he is developing these mechanical changes in his heart, and this picks it up immediately, instantaneously. And besides that, it is much more sensitive than an electrocardiogram, probably 3.5 to 4 times more sensitive than a surface electrocardiogram.
Oh, wow. So this really could be a life-saving device. And you said you've implanted 6 of these, correct?
Yes, ma'am.
At Lakeview. And this is so interesting. Who is getting these devices?
Right now, the alert study is being done with higher risk people, because obviously we want to be able to determine whether there is an advantage of having this device implanted. People who have had myocardial infarctions or heart attacks that are young, or people who have frequent episodes of chest pain that are brought to the emergency rooms, who have had coronary events, are people that we look at, high-risk people, diabetics, people with significant family history. So these are the people that would benefit the most, the highest risk people, and these are the people that need to get to the emergency rooms as quickly as possible.
Let's talk about the feasibility of this for larger populations, because we are talking, there's 6 people at least that you performed this surgery on that have this AngelMed Guardian device. Is this something that someone at home right now watching who says, I have a heart condition, I have problems, maybe I should look into that?
This is, we call it an insurance policy, because the problem is that the average person that has a heart attack does not get to the emergency room for 2.5 to 3 hours. The most dramatic effect that we can have on a person that's having a heart attack is to open up the vessel. The largest effect that we can impose upon a human being is within the first 2 hours. And the sooner that we do it, the less damage to muscle. After 2 hours, the amount of muscle salvage is significantly less. So a person frequently doesn't have classic symptoms.
Right.
They have shortness of breath, they may have indigestion, they may have back pain. They don't have the classic symptoms that we would see in the movies, the dramatic chest pain.
Right.
So what ends up happening is they wait and they do not seek help until frequently a significant amount of damage has been done.
So is this something that's going to become much more common?
We would like it to be. In Europe now, they are testing this program in pacemakers. So a person who gets a pacemaker may have the same advantages as a person who's getting it implanted presently. In Brazil, it is now commercially being utilized, and I think they have a significant number of implants, and doctors are actually using it for myocardial infarction detection and immediate treatment.
What is its impact on the body once it is implanted? Is there any side effects, any impact on the heart or the body?
Other than the implant, which the possibility of a lead dislodgement can occur, but it's rare because they're screw-in leads. They actually screw into the muscle. Infection at the site of implant, which is rare but can occur. Other than that, very rarely would there be any problems. There theoretically could be a lead fracture, but they haven't been in long enough and they haven't seen that yet. But really, you don't know it's in there. The device probably weighs 3 or 4 grams. I mean, they're titanium, and they become part of the body.
Wow. If someone's watching this morning and would like more information on this device, where can they go to find that?
Well, you could call Louisiana Heart Center, 985-649-2700 to ask, or go online and look up AngelMed Guardian device, and there's information on that.
All right. Well, Dr. Eitel, we really appreciate you coming in. Thanks so much.
Thank you, ma'am.